Hi, my name is Julia, and this is QuickRX Specialty Pharmacy. Abiraterone acetate comes in two different doses, the 250 milligrams and the 500 milligrams. A typical dose of abiraterone is 1,000 milligrams a day. So that can be achieved by either taking 4 of the 250 milligrams or 2 of the 500. Which one to choose depends on many different factors. 250 milligrams tend to be a little bit smaller and a little bit cheaper, but you do have to take 4. The 500 milligrams are a little bit bigger and more expensive, but you only need to take 2. Some patients also say that they're coated and actually go down even easier than the 250 milligrams. Which ones to choose is really a decision we can make all together depending on copay assistance. Prednisone is very important for patients taking abiraterone acetate. Abiraterone has a side effect that would lower your levels of cortisol. Prednisone is a corticosteroid that would help replenish those levels of cortisol. So in order to avoid any unnecessary side effects of abiraterone, it's important that patients taking it also take a course of prednisone. Patients take abiraterone acetate for many different amounts of times. It's really up to your provider whether he wants to keep it on you for a year, 2 years, or if you're tolerating it very well and it's keeping your PSA levels down, the provider may decide to keep you on it for much longer. And that's really a decision that your provider will tell you with your care plan. About 80% of medications have the same food-drug interaction, and that's grapefruit juice. Grapefruit juice can increase the levels of certain medications within our bodies. Abiraterone acetate is one of those medications, so it's best to avoid it in order to avoid any unnecessary side effects. QuickRX Specialty Pharmacy is an independent pharmacy that is able to ship to all 50 states. We have 7 locations throughout New York and a whole team of specialty pharmacy liaisons that work one-on-one with patients to help them with copay assistance. Copay assistance is something very common with specialty medications. These medications are usually very expensive and have very high copayments. Now, copay assistance can come in many different forms. It can be through a non-for-profit or through the manufacturer. Overall, there's a lot of resources out there, just about finding the best one that matches your needs.